I'm Krishna, I'm 16 years old. I go to One Tree Hill College, and once I leave school, I'd like to get a career in the medical field.
So we've sent Krishna along to check out a career in emergency response. First up, he meets ambulance officer Simon Barnett.
Hi there.
Hey, I'm Simon. Welcome to St John Ambulance.
I'm Krishna.
Excellent. Let me come and show you one of our ambulances and we'll go from there, eh?
All right.
Excellent. Our job is quite varied. We can go from anything to a really bad car crash to just a sore nana. We never know what to expect, so therefore we go in ready for anything. So first of all, we've got a first response bag. This big green one here. This has got all our main gear in, okay? So everything from a bag mask to airway to bandages and that kind of thing. As well as that, we've got the defibrillator. All right, you've probably heard of these before.
What does a defibrillator do?
Mainly a defibrillator is used to shock a heart, allowing it to restart in its normal rhythm. You know that stuff on Shortland Street and the like?
Oh, right.
So we've got to test that as well. So that's just a basic rundown. Now that we've finished checking that off, we're all good to go. And that noise you hear, that's the tones going off, so someone's got a job. And that's us. Let's go and do a job.
Cool.
Now, Krishna, this is Pamela. We always have two officers on a job.
Hey.
So she's going to come with us, and it's your lucky day. You can ride up the front with me. So after you can jump in the back and just go around the side there once we close these doors. That's the one. Meet you at the front.
Sweet.
The rewards of the job for me would certainly be helping people, as cliche as it sounds. It does feel good to go home and know that you either saved a life or you just helped someone in some way. They call us when they need us, so we help them.
Upon arriving at the scene, an ambulance officer must first assess the situation.
So straight away we've got to stop, look at our scene safety, make sure we're safe, the patient's safe and everyone else. It looks okay.
Okay.
Hiya, my name's Simon. This is Krishna. What's your name?
Chantal.
Chantal. Alrighty. What's happened today, Chantal? You've had a fall. Take a deep breath in for me. Excellent. Is that sore at all? Okay, so straight away we know she's conscious, airway and breathing's good. We'll come back and have a better look at it. Chantal, are you sore anywhere?
My leg.
You are? Okay. What I want you to do is what we call a basic blood sweep. So all you do is with your hands, with your gloves on obviously, start at the top of the head, take 20 seconds to run down the whole body and stop if you find anything that's sore or bloody or abnormal in any way. Alrighty, so what have you found? Well, there's no blood. Looks a bit sore. She's looking a bit painful when we're touching that area. However, the rest of the leg looks all right. So for now, it's not life-threatening. We'll come back to it, OK? The best thing for me is being able to be out there helping people, all different situations, and you can't do that sitting at a desk.
With the patient's condition assessed and stabilised, it's time to move her into the ambulance.
A couple of bumps, it's quite safe.
En route to the nearest hospital, the patient's heart rate and oxygen levels are monitored and blood sugar levels recorded.
Just put that next to the blood and it will soak it up. Good, OK, and that's that. We'll put that Band-Aid on, and soon that will tell us what her blood sugar is.
It's come up with 4.4.
4.4, so it's a good blood sugar.
Simon radios ahead to the hospital emergency ward to brief them on the incoming arrival.
Coming to you with a 20-year-old female who's fallen from a tree, initially KO'd.
The patient is quickly transferred from the ambulance to the hospital's emergency resuscitation room.
Hey, Dale.
Hello.
You just want to go over this side, mate, and take the side rail down. This is Krishna, by the way. He's observing with us
Hi,
today.
nice to meet you. Are we aware if there's any allergies at all?
Not that the patient's aware of.
Okay, great. Thanks a lot.
That's all right. All right, Krishna, I'll leave you with Adele's capable hands, eh?
With Simon's job done, it's time for Krishna to scrub up and get to work finding out more about the role of an emergency nurse.
What we need to do, Krishna, is just cut off her clothes so that we can expose her body and make sure there's no injuries that we haven't missed.
All right.
And we also need to connect her to a monitor, OK? Do you want to cut her clothes off?
All right.
Yeah.
Okay, so why do we have to cut their clothes off?
Just to expose the body and make sure there's no underlying injuries. And then if we need to have quick access, we can have the hospital gown on.
Okay.
How are you feeling there? Oh, you've just got a bit of blood in there. I'll just suction that out. Okay, just open up there for me again. Fantastic. I decided to become a nurse because I enjoy being in the medical field and helping people, and then I decided emergency because I quite like the adrenaline and the fast action and the high turnover. Great, that looks much clearer. Okay, we just need to do some baseline observations. If you'd just like to undo the top of her gown, I'll just get the ECG dots so we can pop them on.
All right.
Krishna attaches the ECG cables to the patient's chest to monitor her heart rate.
So what is the screen telling us?
Okay, so the top one's just telling us the heart rate, okay? That's within normal parameters at the moment. so she's looking good from that side.
An IV or intravenous line is inserted into the patient's arm through which blood samples can be taken and pain relief can be quickly administered.
Now what we need to do is just send off the blood test, okay? I think you'd be good at this job if you want to learn a lot of things, you've got a lot of energy, and you can use your initiative. Okay, now that we've finished with this sharp, we never recap the needles because that's dangerous, so we just put it straight into the sharp spin and it's gone.
An x-ray of the patient's leg shows that there is a broken bone, so Adele and Krishna get to work applying a plaster cast to set the leg.
Now, we just need to be careful because she is sore in that leg, so we need to make sure we support it, okay? So what would be great for you to do is to wrap the soft band around, and that's just going to protect the leg from having the plaster on it and make it more comfortable for her.
So what does an emergency nurse do on a day-to-day basis?
You do a lot of things. You assess a lot of patients, and then you're planning their care, and you're implementing what needs to be done to get them better, either to get them home or to get them up to the wards, and just trying to make them as comfortable as you can in acute situations. You going all right there?
Yep. So has Krishna got what it takes for a career in emergency response?
Krishna went really well today. He was really eager. He wanted to learn and he wanted to participate, which is a huge thing because you need to always be wanting to learn to be able to get good at doing things.
I think Krishna's got what it takes. Really for him now, he can start getting interested and start learning.
I just like going over inserting the IV stuff, getting all the stuff ready, and yeah, it was just a whole new experience for me.
To become a full-time paid ambulance officer, you need to have completed a degree in health sciences. Alternatively, you can start out as a volunteer ambulance officer and extend your qualifications on the job by sitting the National Certificate in Ambulance. These courses can be done through the ETITO, the Ambulance Industry Training Organisation. To become an emergency nurse, you need to have a Bachelor of Nursing degree. This takes 3 years of full-time training at a university or polytechnic, plus a further 1 year of graduate training on the job. Nurses need to have good communication and people skills, including good listening skills.
Supporting local content so you can see more of New Zealand on air.